Hello and welcome to my YouTube channel. It's been a while and I know it's been trying time around the world. First, I lost my dad on 14th of March. It was crazy, and then the coronavirus pandemic. It's been a sad situation for most countries around the world, as most countries have lost one person or the other due to coronavirus pandemic. Initially, it was called an epidemic because it started from Wuhan city in China, in Hubei province, and it's a global menace now where more than 100 countries have all recorded cases of coronavirus pandemic. So to narrow it down to my dear nation, Nigeria, I thought so many times, because a lot of people thought coronavirus wouldn't make any impact in Africa continent due to the weather condition and all that. Though some health experts said that the coronavirus cannot really thrive well in very hot condition, but then that doesn't take out the risk factor of people getting infected by the virus in Nigeria and other African countries. So as we keep on and thinking about what to do to be safe and all that, as we see other countries like European countries taking actions like social distancing, self-isolating in case of symptoms, and then quarantine people who travel to their country for 14 days and all that. So I thought Nigeria, with the population of over 200 million people according to Worldometer, because I use that sometimes, and sometimes we check vested authorities, like we check the National Bureau of Statistics data on the population of Nigeria, but I'll be using the Worldometer one now, which says we are over 200 million people. And out of this 200 million people, statistics that I read somewhere said just 25% of Nigerians actually know what coronavirus is. And I was like, God, there are lots of villages who don't have access to technology, they don't have access to social media. And apparently those villages, the most they can do with their with getting information is just to use their transistor radios. For these people at these remote areas and all of that, not every one of them that have transistor radio to get first-hand information from reliable sources, because there are lots of sources that are not reliable for them to believe whatever is coming out from them. So I thought there are lots of vulnerable people in Nigeria, especially the Almajiri children on the streets, the older people in villages, the not too buoyant people. How do you expect them to practice social distancing, self-isolation, when most of these people apparently are living in a face me, I face you apartment? There is no access to potable drinking water, no electricity, no infrastructural facilities like good roads, etc. How do you want these people to cope? And I thought, what can I do as a Nigerian? What can I do as my corporate social responsibility at this trying time that the COVID-19 pandemic cases is rising in Nigeria from 46 as of 2 days ago to now over 60? What can we do? So me and my team decided to take it upon ourselves to go to vulnerable areas to educate people on what COVID-19 is, the preventive measures we're supposed to be taking, and this social distancing stuff. To jama'a assalamu alaikum. Mun zo don wayar da kan juna ne akan cutar coronavirus wato murar mashako wanda asali daga ƙasar China aka fara samun bullar cutar. Wannan cutar na da illa sosai, yana kisa, ba magani ba rigakafi. Abin da ya sa muka fito kenan don wayar da kan al'umma saboda mutane da dama cewa suke cutar ba na baƙaƙen fata ba ne, cutar na masu kuɗi ne, cutar bai shafan baƙaƙen fata saboda yanayin da muke ciki na zafi. Wannan cutar asali daga ƙasar China aka fara samun bullata a birnin Wuhan. Cutar babu magani babu rigakafi. In mutum ya kamu da shi sai yadda Allah ya yi, musamman waɗanda ke da yawan shekaru. Waɗanda ke da yawan shekaru daga shekara 50 zuwa sama, in suka kamu da cutar sai dai Allah. Kun ji ai wani ya mutu a Abuja sakamakon wannan cuta. Yana da shekaru 71 saboda garkuwar jikin shi bai da ƙarfin da zai yaƙi da cutar. To matakan kariya da za a iya ɗauka shine idan ka ga mutum na tari ko yana atishawa ka ba shi ɗan tazara, saboda da zarar miyan shi ya taɓa maka jiki za ka iya kamuwa da cutar. Kuma an ce cutar yana sa'o'i 48 a cikin hanci kafin ya sauka. In ya sauka garkuwar jiki ba magani. To a lokacin da yake dan sa'o'i a cikin hancin mutum zaka iya rinƙar shan ruwan zafi da lemon tsami a ciki. Kana sha zai kashe cutar a cikin hanci, ba zai biya sauka ƙasa ba. To rigakafin da zaka iya yi kenan. Sai kuma wanke fi da lemon tsami. In aka je gida a wayar da kan 'ya'ya da mazajenmu da 'yan uwa da ke anguwa sabida a samu maslaha. Lemu za ki iya shan ruwan zafi kawai ma, amma sabida lemun tsami na da wasu sinadarai wanda ake cewa alkaline a turanci, yana taimakawa wajen yaƙi da cututtuka. Shi yasa za ku sa a ciki a dafa sosai a riƙa sha, ba wai da zafin ba. In aka dafa ya tafasa sosai sai a ɗan bari ya salance kafin a sha. To shi to sai kuma wanke hannayenmu. Kun ga kuna sayar da abinci, za ku iya ba mutum abu ya ba ku kuɗi, daga nan za a iya musayar cutar. To abin da za a yi shine ana karɓan kuɗi a ibi ruwa a nemi omo a wawwanke hannu.
Wannan ba magana ne na babban mutum ko karamin mutum ba. Ai mun sani manyan mutane su waye ma'aikatan su, ba ƙananan mutane ba. Idan aka ce wannan gwamna ne, gwamna zai zo kasuwan nan ya sayi abinci.
Sai dai masu aiki.
Amma su masu aiki da su ai za su zo nan kaso, kuma su ne kwastomomin mu. To haka abin da ya shafe su ya shafe mu.
Aka ce idan kai cuɗanya da mai ɗauke da cutar a cikin kwanaki 2 za ka iya maganin cutar da kanka ta hanyar shan ruwan zafi da lemon tsami a ciki. Kana sha duk minti 20-20. Cutar na zama a cikin hanci na sa'o'i 48 wato kwanaki 2 kenan. To za ka iya magani akan wannan lokaci da ruwan zafi saboda cutar baya son ruwan zafi. To don Allah abu wannan doka, akwai man wanke hannaye wato hand sanitizer. In ba za ka iya saya ba don yayi tsada, akwai ɗan 600 da, amma yanzu daga 2,500 ne. Ka samu omo, minti 30 kana gama aikin mutum ka ɗibi ruwa ka wanke hannayenka sabida ka kare kanka. Wannan ne hanya mafi sauki da za ka iya kare kanka akan wannan cuta. Kuma a cikin alamomin cutar akwai tari, akwai atishawa, akwai tsananin zazzabi wato zafin jiki sosai. To in ka lura da cewa mutum na da wannan, ka taimaka ka bashi shawaran ya je asibiti. Akwai asibitocin da aka ware domin kula da waɗanda ke ɗauke da irin wannan cuta ko suna nuna alaman suna ɗauke da cutar. To a taimaka, in aka zo siyan abu, gwara ku da kuke wanke hannu ko da yaushe ku je ku ɗiba musu akan suna sa hannayen suna tattaɓawa. We try to speak to people about signs and symptoms of COVID-19, which ranges from coughing, sneezing, and fever. We let them know that once you notice anyone with these symptoms, you should give them space, especially like 5 feet. You count 1, 2, 3, 4, 5 feet to stay safe, because once they cough or sneeze and the fluid that come out of their mouths spill on your body, you're likely to be infected with COVID-19. And from then we spoke to them about preventive measures, which is basically to make sure we wash our hands regularly in the space of 20 to 30 minutes. Wash our hands with soap or detergent, with water, etc. And then moving on to people who have the means to get hand sanitizer, that would help them in disinfecting their hands whenever they feel like their palms are dirty and all that. From then we move to the point that we want to use the opportunity that This hot weather is not so good for COVID-19 to thrive. So we told people that they should make sure that they drink warm water like every 1 hour. When they come back from work, they should make sure they remove their dirty clothes, have a warm bath, and then make sure those clothes are washed or are kept far away, because we all know that, as health workers says, COVID-19 can stay on fabrics for 8 to 10 hours. It can stay on metal for a little longer than 8 to 10 hours. It can stay on other surfaces too for almost same time. So we need to all be careful in making sure that we all deal with this pandemic decisively till we come to the end of this menace, since for the time we are talking now, there is no vaccine, no medication to curb the spread of coronavirus. And we should all know that COVID-19 is not a death sentence, because the mortality rate is between 2 to 3%, and that's really reasonable, because the number of deaths, if not for the aged people that are a little over 60, that their immune system are no longer strong like the young people, it doesn't really kill. So a lot of people have been cured from coronavirus disease, so we should not panic. Irrespective of the lockdown, the social distancing, and some other things that make people feel like coronavirus is a threat to our religion, beliefs, and all that, we should make sure we take precautionary measures. Social distancing, 5 feet, don't go out if you have the means to stay indoors for now. And if you are in states that there is no recorded case, we need all to be careful, because there is no recorded case right now in a particular state doesn't mean it can't get there. The federal government is trying to trace over 4,000 people that may have had contact with people that have confirmed cases of COVID-19, and they are unable to reach them because most of them put information that are incorrect or wrong information so that they won't be traced, etc. So we all need to be careful at this trying time. That's my piece for you on COVID-19 right now. If you're just watching my YouTube video for the first time, please make sure you do like, subscribe, and then leave comment in the comment section in case there is anything you want us to talk about at this trying time. Please stay safe. Make sure you practice social distancing. The lockdown might not be easy, but if you have the means, please obey the government at all levels on the lockdown, and then make sure you are safe. Many thanks for watching. See you next time.